Good afternoon, everyone. Those people are wandering in, please take a seat. For those that have not met me, I'm Jenny Mobbs. I'm the CEO of COTA ACT, but I can see lots of familiar faces. Welcome back. Today we have OPAN here with us, and COTA Australia, of course, and people from Atticus, which is our local organisation. And also Services Australia. Lovely to have you here. Back from holidays, I see, which is good. Just so that you know, and for those people who haven't been here, the bathrooms are out that door that you came in and to the left, and the COTA office is also down that way. As an ad for next week, we are doing the Seniors and Better Ageing Expo next Wednesday, 24th, and we hope to see all of you at the Old Bus Depot markets. Catch a bus. I've conned Transport Canberra into giving you free transport for the day. It's great. But welcome. We should acknowledge too that we're meeting on the land of the Ngunnawal people today and pay our respects to their elders past, present and to their emerging leaders. We also acknowledge the support of the Department of Health, Disability and Ageing, and in particular the Minister for Aged Care and Seniors in supporting today's event. I might leave it to Craig to explain OPAN's role and to Pat to explain COTA Australia's role. But today is not about us. Lots of you I know come to our midday matters and we do local issues, but today is about a bigger issue about the Aged Care Act and the reforms that are coming into place. They're big and quite overdue, as many of us realise. We're going to take you through the substance of all of that today, and we'll ask you about your priorities, and we'll collect those questions and responses as we go through the day. But I'm going to hand over to our esteemed colleagues for the day.
We're good to go. Thanks so much, Jenny. Welcome to everybody. I'm Pat Sparrow. I'm the CEO of COTA Australia. COTA Australia is a body that works with COTA ACT, and we undertake systemic advocacy. So we listen to what older people are saying and advocate for broad reforms. This is my fantastic colleague, Craig from OPAN. Do you just want to say what OPAN does?
Sure, thanks, Patricia. Look, OPAN is the Older Persons Advocacy Network, and we're all about the human rights of older people, and particularly focused on people that are seeking or receiving aged care. We are a network of 9 organisations, plus us as the peak body, and Atticus is your local member in the ACT who provides that individual advocacy support, and I'll tell you a little bit more about it as we go through today, and they'll give you, they'll speak at the end to give you a bit more information. But fantastic turnout today.
It is a great turnout.
Amazing.
It is a great turnout.
We had Sydney yesterday and we did not have this many people, so
well
done
ACT.
Are
you saying ACT's better?
ACT's better than Sydney.
Wow.
And I'm from Sydney.
Oh.
Yeah.
And look, just to let you know, we have got some catering on the way. It should have been here, but there will be something to nibble on later in the day. And probably just worth saying about COTA Australia, one of the differences, I guess, is we actually do systemic advocacy across a range of government portfolios, so aged care, health, employment, retirement income, so we're sort of very broad in terms of our scope. But as we said, it's not about us today, it is about the reforms, and we wanted to do these sessions because we were really concerned that there was information missing and that people in the community weren't getting the information they needed, and you're the most important people in the reforms. So while there's lots of things today we'll go through that we support, we'll also be able to outline areas where we think there's more work to do. But the key to making all of this work is you having the information that you need as you're either looking for aged care or you're already getting aged care and you're looking for what the difference is going to be. So that's what today's about, isn't it, Craig?
Yeah, I mean, establishing an aged care system that actually works for every single person in Australia is what's really, really important, and it needs to work for people whether they've got money or not. And so we don't want a two-tiered system. And there's some really good things that are in this new Aged Care Act. There's some challenging things as well, which we'll talk through today. But it's important that we make sure that this new Aged Care Act works for older people and all people in Australia. And yeah, it's important that you have information because as Gwenda Darling, who's in the room, says today, she's with us, and she says knowledge is power, and I think that's what it is, and we want to see you to be able to take this knowledge and information out to your network of family, friends, community members, people in the coffee shop or in the supermarket who you run into if they ask you any questions or information for yourselves as well.
So hopefully today we've got, you'll get that in the 2 hours we've got, which we acknowledge is quite a long time. We will probably take a brief break at about 3, and hopefully by then the catering will have turned up. Apologies to people who are online, you'll have to do your own catering, but hopefully we'll take a brief break at 3. But if you do need to get up and take a comfort break or just stretch, please feel free to do that. Now you'll notice on your table there's a lot of information. We're going to use a thing called Menti. We've teamed up with Essential Media to use a feedback tool that they have called Civility, and Peter Lewis, who's with us here today, he's going to explain how it works and give you a couple of test runs so you feel confident using it throughout the session. Over to you, Pete.
Thanks. Oh, I'll try this one instead. Thanks, Pat. Hi, everyone. A lot of you have already logged in. Put your hand up if you have. Put your hand up if you're refusing to. Good on you. Those people can use their hands during it. One of the reasons that we want people to feed in their questions is we're doing this around the country and we're really interested in getting everyone's questions. So not everyone's questions will be answered today, but the more that we collect, the more information we've got of the questions in people's minds. If you do have problems getting in or you've just come in quickly, we also recognise the bandwidth's a bit low here. So on the bits of paper, there is actually a very ingenious password that looks a lot like guest VIP, which you all are. So let's get started. Can people... We've got about 35 people that have clicked it, and I'm reverbing a little bit, but if everyone wants to get in there, click that, and we might just have a little practice. Click the slide along Mayank, and we're really interested to know at the start, and have a look at your phone to enter it in if you can, and the QR code is there on the bit of paper. What best describes you? Are you someone who is accessing aged care support now, i.e. home care package? Are you someone who expects to use it in the next few years? Or are you someone who is supporting a family member or friend to navigate the system?
And if you're having any trouble at all logging in, put your hand up and someone will come and give you...
We've got some tech angels around the room.
And totally respect those who have decided not to. So we need someone to come and assist down here.
That might have just
Sorry.
unboxed it. 1870.
I don't give that away to everyone. We're beaming on the internet.
Well, clearly people are working it out because the numbers are going up, which is good.
So then just put in which one you are. So the numbers are going up, and we've got a bunch of people joining us on the stream as well. So it also
and what this also helps us to do is to know what information to give you through the session today, and we are going to take you on a bit of the aged care journey, so that for those who are new to this process, we hope you go away with a bit more information about how the aged care system works, but also for those who are in it, how things are going to change.
And just for those that are refusing to use the tool, show of hands on that one. Who's currently accessing aged care support? 1, 2, or like that. Who expects to access in the next few years? And who's supporting a family member or friend? So we've got a good mix around the room, which is fantastic.
It's terrific.
Secondly, we wanted to ask you one more question, which again, we'd love to come back to at the end. So on a scale of 1 to 5, where 1 is strongly disagree with this statement and 5 is strongly agree, how well informed about the changes do you feel now? If you've got no idea what's going on except there's lots and lots of paper, put a 1. If you could be up on stage with Pat and Craig, put a 5. And if you're somewhere in the middle, let us know.
Great.
And then also, based on what you know at the moment, how supportive are you about the changes? We're really interested in that as well. Oh, 5. Ooh, we've got somebody, a live one. Let's see if you stay 5 for the whole thing. Yeah, no, you could be marked down. So we've got low information, which is totally understandable because there is a lot to get through. And people are kind of in the middle, ready to be convinced that this is a good set of changes. So I think that's a good setting to get into the guts of it. At any time that you want to ask a question, put it into that little Q&A thing at the bottom of your phone, and then I'll be coming back and feeding those into the discussions as we go. Over to you guys.
Great. So for some of those, we'll just go on to our next slide. We're giving you a little bit of a potted history of aged care in Australia. Taking back about 70 years, I think if I get my figures correct, was the first introduction of the Commonwealth Government funding what was called the Aged Persons Homes Act. And that was under the Menzies government, for anyone who remembers back then. It was the first time there was a national intervention and funding that was there, capital grants to build aged care homes, nursing homes as they were called at the time, and a lot of that went to churches and to not-for-profits to build those homes, but to really put it as a not-for-profit model in place in Australia. Jump forward to 1985 and the Hawke era, and you started to see people go, well, we actually want to do more of these services in our homes. We'd rather stay in our homes and get services to come to us. So that was the start of what was called the HAC program, Care in Community, or the Home and Community Care program. And it was things like meals, transport, just personal care. 1997, which is the current legislation that we're working under, which was the Howard era, and it was the Aged Care Act. So we're getting close to 30 years of this current legislation, and it's been adjusted and added to and all those sorts of things, but was primarily still focused about providers and about how we're going to fund those. But it was where co-payments started coming in, and user contributions, means testing, but also an accreditation system and a complaint system that sat around it. But it really expanded the private provider's role coming in and doing that provision. 2011, 2012, and I know COTA was really strongly involved with some of the development of this, which was a really big change of the Living Longer, Living Better reforms, and that was under the Gillard government. And that was really starting to say, older people were saying to you, I think, but Pat, to COTA, that they wanted to be in control. They wanted choice and control in their packages, and to be able to...
Absolutely the point, that people felt that things were being done to them, and
Yep.
there was a big push to make sure that people could have more control over what was happening.
Yeah, and that was where the thing called the My Aged Care Gateway, which is now called My Aged Care, which was a guidance tool to kind of get you into the system, and we'll talk a bit more
And
about
it was
that.
originally intended that it would be a face-to-face
That's right.
a face-to-face place to go. That's not how it ended up, but nevertheless it still gives an initial port of call for people.
Yeah, so there's more flexibility, more choice, you got your package, it was consumer-directed care. Most of you would have seen sort of some of the stuff that was on the ABC back in 2017, 2018, which kind of was some really horrific stories of abuse and neglect, which led to the Royal Commission. And between 2018 and 2021, we had that Royal Commission go on, which really came out with 148 recommendations and said, we can do better in Australia. And we're still implementing those recommendations.
Yeah, it was really hard, wasn't it, watching the Royal Commission, and so many brave people came forward and talked about the experience that they'd had. And it has led to the Aged Care Act. And one of the important changes, and why we think the Aged Care Act, this slide is showing you the Aged Care Act is different in 2024 to 1997. 1997 almost exclusively talked about the relationship between government and service providers. This Act is actually much more still talks about those things, but it puts older people at the centre, the people who need support. It focuses on older people's rights. It focuses on making sure that the quality is better for people, and so we think that's a really important shift. And it is it's a rights-based act. and that's not something we've had in the past. And that was the main recommendation from the Royal Commission, that to fix all of the terrible stories that came out and the way the system was working, it needed to be fundamentally shifted and addressed to having a rights-based framework. We absolutely, both organisations have been very supportive of that shift. We also say through the Act, and you will see through the Act, and we're going to talk about it a little bit later on, supported decision making, that older people need to keep that choice and control and strengthen it even more than what it was in 1997 to have more agency. And so the new system's designed to do that. So what you're going to find over the next little while is that they are big changes and they're quite complicated and they will change, but we want to try and drill down today and give you that information. I'm going to go top level first and then get into the details. So the Act is this still me talking here? Is 1,400 pages.
1,400 pages.
If you can believe it.
The Act, the rules that go with it, the amendment legislation, it's a huge amount of information to get through, which we're not going to make you go through today.
No, and we're definitely not going to. And look, it was passed in 2024. Originally, it was going to be implemented from 1 July 2025. It came to light as we were getting closer to that date that government and providers weren't actually ready to start on the 1st of July, so we shifted the start date, or the government shifted the start date to the 1st of November. Now, COTA and OPAN supported the delay because we wanted to make sure that older people could get more information than they already had, and we didn't want the systems not to be ready. But one of the things that we didn't say was that we wanted home care packages to be delayed. So you will have seen, and I'm sure Canberrans all watch Parliament House all the time, but you would have actually seen that there's been quite a lot of discussion about the number of people on the waiting list, the fact that packages weren't being put through. So it's 78,000 people on the wait list for a home care package now, 121,000 people waiting to be assessed, and government had promised 83,000 packages to come through the system, but they'd instead of putting them out from 1 July, they delayed that. But with the work of Senator Pocock and the Senate and organisations like OPAN and COTA and Ageing Australia and others, the government has now agreed to start putting packages into the system. So there'll be another 40,000 it is coming through before Christmas, and then the rest will come through before 1 July. So there's lots of good things about the Act, and as I said, we don't agree with everything and we'll continue to advocate on those, but we're in that messy process where you're all waiting to see what happens from 1st of November. So let me go through the big structural changes if we bring up the next slide. So the first thing to say is it does have a statement of rights, which is really important, and it talks about respect and dignity, it talks about choice and control, and it's focused on you having rights in the system. Supported decision making, acknowledging that as an older person, you can make your own decisions. Sometimes you might need support, but you can make your own decision, and Craig's going to talk you through that in more detail later. It does have stronger accountability and transparency for providers. One of the other things that we advocated really hard for is that the Complaints Commissioner, while still in the Quality and Safety Commission, is an independent commissioner. We think that's really important. We felt there was a bit of a conflict between the Commissioner being the same person who dealt with providers. We wanted someone who could deal specifically with the issues concerning older people and their families. And we've got the change from home care packages to support at home. It does also change financial contributions for people. And we're going to talk through that in more detail as well, or as much detail as we can today, so you know as much as you can. There are new eligibility requirements. It's much clearer now that you need to be over the age of 65 unless you're an Aboriginal or Torres Strait Islander person or a homeless person. It used to be a bit more flexible than that, and the government decided that they needed to make sure that they didn't want younger people with disabilities being stuck in a nursing home, which is probably the right call, but we hope that there aren't people who are left stranded without support. There's a single assessment process. So rather than you having to find whether you're going to an ACAT or a RAS or whatever they were called, different names of them in different states, there's just a single assessment process for you to go through. The quality standards have been strengthened. So there is more focus again on you as a person. There's some new standards on food and nutrition, and we'll talk through those in a bit of detail too. There are stronger whistleblower protections for people who see that something is not working the way that it should or is concerned. And that might be a family member, it might be a staff member, it might be a member of the community who's aware of something that's not quite right. And there is a code of conduct for workers and providers.
So these things we think are good things that will be strengthened and supported. And as I said, we'll talk through the financial contributions in more detail. So you can see it's quite a lot of change, a fundamental shift. And as I said, we absolutely support the focus on rights and giving you the support you need to exercise your rights and holding providers to account. Now, Craig, do you want to take us through what happens? There's two pathways, right?
Yeah, and just another point on statement of rights, one of the things that we really pushed for, because it sort of said originally in was being considered that just don't do anything that's not compatible with the statement of rights. But one of the things both of our organisations push for is, like we want to do and prevent sexual harassment, and there's a positive duty on employers to do that, there needs to be a positive duty on providers to actually hold the statement of rights. So it's not just a nice piece of paper and that is enforceable. I know there's a lot of discussion about whether they are that enforceable or whether the Quality Commission can take action, but they can. If your rights are being breached, they can take action, and there's obligations and fines on providers if they don't uphold that statement of rights.
And I should say too, you should find on your table, if it's not on your table, it will be at the back, a one page that OPAN has developed that's about the statement of rights to give you more information, so you can read that at your leisure.
Great. It's just disappeared. The two pathways that we're talking about, in a nutshell, we have the supported home program. Now, people would have heard of possibly the Commonwealth Home Support Program and home care packages, and some of you might be receiving those services at the moment. What happens from 1 November is all the home care packages and what's also called short-term restorative care gets rolled into what's called supported home. Commonwealth Home Support Program, which is like cleaning and gardening and those sorts of low-level supports, that continues on probably to at least 2027, and they're still got to work out how we're going to bring that into the system as well. But the supported home program is really about a higher number of levels of care. At the moment, there's 4 levels with the home care packages. Under supported home, there'll be 8 levels, and it will go up to the top level based on your assessed needs, and that's a top level of funding of about $78,000.
Craig, just one question we got yesterday. Does everybody know what a package is when we say a package? Do you want to just...
Sure. So what a package, I mean, basically you'll be assessed, and we'll come to how that process goes, but it will be a set of services, but then a bucket of money that pays for those services. And so that's where sort of it's a range of things. It might be nursing care, it might be personal care, it might be, again, helping with the cleaning and gardening. All those things wrapped up together to what you need, based on what you want as well, is really what comes together into a package.
Whereas some people who are getting something under Commonwealth Home Support might just be getting someone to do cleaning or something like that. So that's the difference.
Yeah. So the other thing that comes with supported home, which we really think is great, is a thing called the Specialist Restorative Care Pathway. And that's about allied health support. Often people come out of hospital, or they have a fall at home, or their functions are declining a little bit. This is really to get you back on your feet. So it's getting physiotherapy, it's getting the occupational therapy to strengthen you and to keep you living in your home and keep you independent. It's one of the biggest things we've heard from older people as we've gone around the country, is they say, I want the choice to stay at home, and I want the supports that are needed that are going to keep me independent. And this is what will help do that as well. There's also a specialist end-of-life pathway. Around about, I think it's in the high 77% of people say they want to be able to die at home, and only around about 11% get to do that. So this is an additional amount of money that's there for 3 months when someone's been told that they're end of life, to provide additional services and supports. There'll still be the connection into the territory palliative care services, so it doesn't separate from that, but it's top-up services that can support you and your family during that time. The other thing is the assistive technology and home modifications. People have had to be, under the packages, had to be kind of saving for the rainy day. So if you might need the wheelchair, the walk and that sort of thing, you had to save up and see if you had enough money. this now gets approved to different levels, up to $15,000 right up front. So that's a really positive thing. Now, we're going to keep an eye on it, whether that $15,000 is adequate, but at least means you don't have to wait to get those supports. There is means testing, which means that, like with our tax system, those who have more income and assets will contribute more, and we'll take you through that. The second part of the pathway is residential care, and you might get approved for residential at the same time as you get approved for supported home. So it gives you the choice of where you want to be. But biggest thing for this is about the strength and quality standards, and I'm going to take you through those a little bit later on. There are some changes to the charges and fees and how that's structured. And then there's also what we think is really positive, and we've pushed hard, that some additional services like your Foxtel, your internet, your newspapers, your glass of red wine with dinner. Sometimes the provider said you'd have to sign a contract for those things before we'll let you come in and come into our residential facility. We don't think that should be a condition of coming in. And so they might tell you we offer these services, but you'll have 28 days. You'll have some time to think about that and see whether they're things you want to use or can use. And then you'll have time to agree to that in the end.
What's really important is that you're clear when you go into residential care. This is what I'm going to get based on what the government is paying and what my contribution is paying for. And then anything on top of that is additional, and I can decide whether I want to have it or not. But you should be guaranteed that base level of care.
Both for that supported home and for the residential, there's a list of services that have to be included that you can access. So those services that are included. So we're going to go a bit more detail in a few moments, but Pete's going to come up and take some more questions from you.
The questions are actually rolling in, so thank you everyone that's using the tool in front of you. First one, Craig, is around timing. It was a question that was asked yesterday as well. At what point should people get an assessment? Do you do it like before you need care, or when the clock's ticking?
Yeah, and so the advice yesterday from Val Fell, who was he's on the Council of Elders, and it sort of was a user of the system, had been on Commonwealth Home Support and was trying to get a package and had been in hospital. And her suggestion was, get assessed now. Think about in 3 to 6 months' time what you might need to stay independent. So this is about keeping independence up. And so you might want to register. We know there are waiting times, and we'll talk through that a bit later, but you can register now, and I'm going to take you through shortly about how you do that. But start early. Think about what are those things that you're going to need to keep you independent living in your home.
And I think the conversation yesterday too is in part because there are waiting lists. Like, don't wait till you get to the point where you really desperately need help. And that we know that that's what people often do, that people are reluctant to put their hand up, but don't be, is the advice.
Yeah.
Another question here. One of the problems with the present system is that different staff come each week. Community nursing manages to allocate staff in an area, and so staff get to know their clients. How come private providers can't manage that?
That is a really good question.
It's a really good question, and one we ask regularly. I mean, we know there's been some workforce shortages, but it is an area, and we do appreciate that that's difficult for people, and something that we keep talking about and saying there needs to be a good workforce strategy to support more people coming into work in aged care.
And probably as the statement of rights starts to come to life and gets put into practice, it is your right to actually say, hey, this is the worker who I really get on well with. Let's see if we can schedule that right. Yep, sometimes there's a bit of negotiation, but there should be more choice about who comes into your home and when they're coming into your home. Can ask for that.
And finally, for now, the grandfather question. Any grandfathers in the room?
Or grandmothers.
Yes, well, but do we grandmother this as well? Will people who have a huge amount of money in their package unused have to hand it back? Under the new system, you can only have a certain amount roll over each month. This needs to be uniform.
The money will roll into the new package, your unspent funds, and you'll be able to spend it. There won't be a time limit on the time you have to spend it, is what we understand.
Most of the other questions are going into specific detail I know we're going to get to, so we might not do that now, because I think we are moving into our core topic areas
We
Before we do that, we want you to whip your phone out again and tell us which are the ones that you're most interested in hearing more about. Now, the good news is we're going to cover all these issues, but we're just particularly interested in where people's main interest areas are. So you can just sort of put them in order, first to second to third. Like, I know that love all our children. Let's just give that a sec while see if we
Can I just apologise while that's happening? You probably saw I got distracted by the phone. There was a number that had rung me like 5 or 6 times in quick succession. I thought it might be your caterers, so I was just trying to make sure that we were going okay.
And was it? Oh.
I don't know who it is, but what I can tell you is they're going to...
All right, so this starts getting exciting because it becomes a bit like a horse race.
Okay, who's winning?
Getting in it. So
Come on, finding care. That's my one. So that's going to go. And we want some more votes for that one.
Do you want...
We'll get
Pat, you're going to win again on supported homes.
Of course I am.
Yeah.
Yeah.
What about you that aren't using your phone? What's your number one? Yeah.
Number one, supported home. Yep.
Okay. The technology isn't lying, but that's good.
Yep.
They're all important and we will cover all of them. So don't feel like if you've put something down lower that's really of interest and it hasn't come up pretty highly, we will still...
And they all kind of fit together.
They do.
Don't they?
But it's really helpful for us to know what the topics of most interest are in terms of follow-up, etc. afterwards, and what sort of information we can talk to government and departments about making sure is available.
All right. I think our time is up there. Let's move on, Maya.
Great. So let's get into it. We are going to talk about finding care because that's kind of where you start the journey in aged care. And as we said, we want an aged care system that's actually designed around people, around you, not around the providers. Now, the aged care workers are really important. They are, I suppose, the enablers of the system, and we need them to have the right training, the right wages, and the right attitude because they are key to this. But the system needs to be designed really around you. One of the things we've heard from people is they want to tell you their story once. They don't want to have to keep eating it over and over in time as they go to a different provider or a different part of the government system, those sorts of things. And so it can be really complex when people are trying to navigate that between home care and residential care or end-of-life care, or you're moving in different parts. What we hope to see in this new system from November, that information follows you along the journey as well. And kind of in that time when there is an information scarcity, it can be really hard to get and not feel vulnerable that you're making decisions, and also that can end up in poor quality care. When people have got those concerns, that's kind of is a good time to call the advocacy program, and ADACAS provide that frontline advocacy that can help. There's also a program called the Care Finders that can help people to navigate into the system as well. And we'll put numbers up as we go through today. You'll also get a copy of the slides afterwards, so don't feel if you've missed something on the screen that you're not going to get that information afterwards. So what we hear from people coming to the advocacy services like ADACAS is that people feel that communication's really poor. People feel that the providers, just like Peter was talking about before, not telling when someone else is coming, a different person's coming. We want to see that improve. And often that older people aren't listened to and their rights aren't respected. And so this is the shift we want to see. So getting into the system, how do you start? My Aged Care is the key, kind of that gateway, and you can call them on 1-800, and am I going to get it right? Is it up on this one? 200-422. I think I remember that. 1-800-200-422. Now, they will talk you through the different services. They've also got a website, myagedcare.gov.au, and it'll step you through and ask you some questions about the types of services that you might need. They will then book you in for the assessment service to talk to you. When the assessment service rings to have an initial chat, that's about them trying to work out how urgent it is for you to get your face-to-face assessment. So it's really important to give them that information, tell them how things are going, but how things might be deteriorating as well. So talk to them about hey, this is what I'm having trouble with, or this is what I think without my family member or the rest of my son and daughter coming, these are the things I find challenging to do, because that will start to then get you in the priority to a high priority, medium or low. That prioritises you then for someone to come out and do the assessment. Now, our view is that those assessments are best done face-to-face, and that should be what the single assessment service is doing. We have heard that there's a long wait for that at the moment, and particularly in the ACT. So that's something that the department and the government are monitoring, and we're hoping to see improvements in those waiting times for the assessment going through. Once that person comes and does the assessment, they'll work with you about what are the types of services, the clinical services, the services that will keep you independent, and then the everyday living services, assuming that you're going into the supported home pathway. They might also, as I said, say, yep, and you could be eligible for residential if you want that as well. So we've been booked, you've got your assessment, they'll help then develop up a service plan. You'll find that then once you've got that and got that approval, is go out and look for a provider who will then start to work with you to develop up what's your care and services plan. Now, this should be done jointly with you. It will be, because you need to sign off that these are the things that you want. You stay in control of this. And we know those waiting times, as I said, have been frustrating. We're going to keep pushing to make sure that those waiting times come down. They've been taking on a lot more staff, and so that we have seen some improvements in the wait times. But we've got to keep making sure that we see improvements, because you end up waiting. So yeah,
Clearly 121,000 people waiting for an assessment is unacceptable. And so we are pushing, we are really pushing for that. And we also will have wait list reports for people waiting for home care packages, which we think that transparency will actually help motivate investment.
Yep. So we will keep making sure that things improve in that supported home. Pete, any questions on that?
There is
finding care apart on the assessment service?
There is both a question and a comment. Let's start with the comment. Older people should think forward about where they will be in 6 months, but when it comes down to the assessor, I find they do not think the same way. They say request another reassessment.
Yeah, and I think there needs to be a balance here. They are using a tool called the independent assessment tool, which does give, I suppose, a consistency of approach in how that's done. But I think people should be honest about where they're doing. I think often people say, "Oh yeah, I can do the washing, I can do my own washing, those sorts of things." But saying it actually really impacts me when I do that. I feel exhausted afterwards, and that's why I need some that. Yeah. So stand up, speak up, use your voice in that as well.
But it's also a fair comment that, people are often told they'll have to go back for a reassessment, and then you feel like you're caught in that waiting again. So we do understand the issue that's being raised, and something we can also keep an eye
on to make sure that reassessments, once you come into those levels of 8 packages, as I talked about, if you're on a lower level, you can ask to be reassessed if those services aren't enough for you. And that's the other part of the system we're going to be monitoring to see how quickly those reassessments happen as well, which might put you up onto a higher level of package.
Now a real question. We have aged care high level approval for many years, but currently only require minimal services. Does our existing approval continue, or do we need to be assessed again?
I believe it continues.
If you've been assessed at that level, even if you're not using everything in your package,
yep.
You should stay on that package and transition across on 1 November.
Which we're going to talk a little bit about in a minute.
And one more question here on that. Will the transitional aged care program continue?
Transitional aged care, which is about people coming out of hospital,
yep,
does continue.
Yes, it does.
Continue on. And I think there's actually been an increase in the numbers of places that helps you if you're coming out of hospital to have that allied health support. So it's kind of like that rehabilitation stuff that means you can get out of hospital earlier. As I said before, there's also the short-term restorative care.
And we do know across the country, but we know in Canberra it's quite bad at the moment too. people who are in hospital and who can't get support to either go home or into residential care. So these types of services are really incredibly important.
That's all I've got here, unless there's any of the non-tech people with a question at the moment. Oh, no,
There's one.
I'll just bring the mic over so people can hear you. There you go.
I'll just make a comment. My husband and I have been approved under the Commonwealth Home Support Service, and we wanted domestic assistance. I think I rang about 30 providers until we found a provider who has now agreed to provide domestic assistance.
I'm sorry you've had that experience, but unfortunately, it's not uncommon that it's difficult to get a CHSP provider who's got capacity.
And the other thing is, I wanted physios and exercise physiologists through the same group, like Commonwealth Home Support Service. The providers run out of money. Is more money going to be put into Commonwealth Home Support Service?
Well, so that's decisions for government that I don't really have an answer for. But we are advocating that there's not enough CHSP services and that they are quite disjointed around the country. So in some areas you can get some things and in some areas you can't. So we are actually advocating around that. And as Craig said, when it comes in 2027, we've got an opportunity, I think, to be having a look at how it gets done better.
And once you get onto the supported home package, the plan is to make that easier to access those things because it's not capped out. The money's there.
Yep.
Yeah.
Hello, I am from Young. I've been invited over by my friend.
Lovely. Thanks for being that way.
Well, I've just wanted to come to understand, because in Young, we only have 2 or 3 selections, as you'd be aware, as to who we have. But I've been lucky. I have a 2-hour once a fortnight, and I have my regular person, as you said. I didn't demand it, but I
You stood up for your own, mate.
Requested.
You stood up for your rights.
because I have a choice of 2 or 3.
Yes.
Yep.
And I'm quite happy with that. All I was coming to you for, we will not get any extra benefits in Young from your discussing roughly now. So we sort of just wing it basically as we go along.
And we do continue to advocate for more investment, for it not to all just focus on metropolitan areas, and how do we make sure that in regional areas people have more access to services. It's a bit of a wicked problem, but it is definitely something that we are advocating about.
Yeah.
One more.
You mentioned change of circumstance for the older person. What about if the change of circumstances with the carer who's a younger person and things aren't looking good?
And perfect.
Yeah, I think we often rely too much on carers to say that they take, and without carers, the burden on the system. It's one of those things you sort of need to do the assessment and know that there's a carer there, but what happens if that carer wasn't available? What happens if they went to hospital? So that the services, and then part of that is what the conversation needs to be with the assessment team, that, hey, this person might not be, they might be there one day a fortnight that your daughter or son can hop in and help, but they may not be there all the time. So it's important to be, I suppose, thinking of the carer being part of it, but also what happens if I'm being carer agnostic in that sense as well. So the assessment, you need to tell the assessors about that at the time. What happens if that person's not available?
And I think if circumstances do change, then talking to your provider, and potentially if that means that there is a reassessment. We know reassessment's not ideal, but I think there is a place in the system where if there is a exceptional circumstance change and need to change, you can go back and do it that way.
One more up the back here.
My question relates to the transition from home care packages to supported home. There'll be a number of people.
We're going to actually talk about that next, but
No,
go on.
now my question relates to the fact that people would have been assessed for a high level of care, but have not been allocated.
Their packages, yeah.
And what is happening to those people in the transition period?
So what we hope will happen is that the new packages that are coming into the system will be allocated to people who've been waiting. And then there is a transition process from having a package in the current system over. So hopefully with the 40,000 packages that are coming through pre-Christmas, another 40,000 after Christmas, people will be getting packages and transitioning into the new system. And I can talk a little bit about what the transition looks like once you've got a package.
So they'll transition across at the existing.
Or an equivalent, because we've currently got 4 levels of 4 levels of packages, and we'll have 8. So there'll be, transition over to something equivalent in the new system. And hopefully for people who've got higher needs, they'll end up on a higher package.
Thank you.
So that's a really good segue, I think, to talk about supported home and also packages for those who are on package at the moment.
That's it. So I'm going to try and take you through this succinctly. There's a lot of detail in this, so I'll try and make sure I'm as clear as I can be. So we're going to assume that you have been assessed or you're accessing a support at home package now. So as we said, just to recap, that's 8 levels of packages. There are the specific pathways for rehabilitation and for end-of-life care. There's also 3 groupings of service that you'll hear talked about: clinical care, independent service, which is things like personal care, and then everyday living, which is things like cleaning and gardening. So that's the kind of broad overview of what's in support at home. Now, for those of you who are already receiving a home care package, you will actually transition across. You won't have to do anything in particular for that to happen. You'll transition across to something similar in the new system, and you will not have to pay more than you are currently paying for the services. So it's referred to as the no worse off principle. So the no worse off principle means you won't have to pay any more than what you're currently paying, but your service provider will come out and talk to you about other things that are changing. So a couple of things have changed in the system that are worth you knowing. The service list, which is the list that government says these are the things that we will fund and these are the things that we aren't. There have been some changes to that. So there may be something that you're currently receiving that's not on the list anymore, and the providers will talk to you about that and talk to you about what else you might be able to have instead. The other thing is that providers will, for the first 12 months, will be setting the prices for the services that you're receiving. Now, this is not, we wanted the Independent Pricing Authority to be setting those prices from day one, but that's not where it's landed. So providers will come out to you and talk to you about their prices, and if their prices may have an impact on the amount of services that you can receive. Now, providers' prices will be monitored by the Quality and Safety Commission to ensure that they're reasonable. And if you don't feel that the price is reasonable, you can actually make a complaint. The other courses of action available to you are, as we've already said, if you think, well, now I'm not going to get enough support that I need, you can also ask for a reassessment, and you can also look around for another provider if you think that you're not happy with what your provider's proposed. But you'll transition across. You won't have to pay any more fees. I'm going to hold for questions till the end. The other thing that happens is, for those of you who are currently in the system, may be being asked to pay what's called a basic daily care fee, or you may be paying an income-tested care fee. Those fees are replaced by the new fee regime. So you don't have to pay that plus something else. So they will just transition as well. So your fees that currently look like a basic daily care fee will transition into the new system, which I'm going to go through in a bit more detail. So hopefully that helps those of you who are on. It will happen. There'll be discussions with your providers, and you'll go from there.
And I think what we heard as we went out and talked to people about the foundations of the Act and the supported home system was people were feeling like they were paying for services that they weren't getting.
Yes.
And so that's why it switched to now a payment on the service that you for what you actually use, rather than just being charged for every day.
Yeah, that's absolutely right. Now, in the supported home packages, one of the things that will happen for everybody is 10% of the value of the package. So you'll have an annual package amount. So if you're on a level 8, that's the $78,000. It's broken into quarterly amounts to sort of monitor and allocate a fund. 10% of that $78,000, if we take that example, will be put into care management. So that's the provider will have access to that money to give you support. That might be helping you to find other services, or if you need other things, they'll be able to help you to do that, monitor what's happening and make sure you're doing okay.
And there's a requirement for them to contact you and have a care management session with you at least once every month.
And as I said, the budgets are quarterly and they align to the package level. So on the lowest level, it's about 2,750 a quarter, and on the highest one, it's 19,500 a quarter. You've had your assessment, you've been allocated a package level. What's going to happen next is you're going to start to negotiate your service plan, and this is where Craig was saying this is about what you want and what you need. And again, it's really important that you talk about those things for the package to be designed that way. I'm just thinking we might need to move to the other slide. There are some general things to say because I'm going to go through what this looks like now in terms of the services and the packages. For most services, you're going to be asked to pay a co-contribution based on that assessment that you have. But Services Australia will assess your income and assets to determine what you're going to pay. Now, what we know now, which we're pleased to hear, is that you will, if you have a package allocated to you, or you're currently in the system, you'll get a letter from Services Australia, probably in early October, that will talk to you about where you sit in these percentage ranges, which I'm about to go through. It won't say to you specifically the percentage you'll pay, but you'll know roughly where you're going to fall. So if you look at that table, and I'm going to look at it here so I don't crick my neck, you'll see clinical care, which is your nursing and allied health. The government's fully paying for those. You don't have to make a co-contribution, whether you're a full pensioner, part pensioner, or a self-funded retiree. Government picks up the cost of that. The independent service, which as we said is the personal care and social support, people will be asked to make a co-contribution. If you're a full pensioner, that will be 5%. It will be somewhere between 5 and 50% if you're a part pensioner and on a Commonwealth Seniors Healthcare card. And for a self-funded retiree, it will be 50%. For everyday living, which is your domestic assistance and gardening, full pensioners 17.5%. For part pensioners, it's 17.5% to 80%, and a self-funded retiree will be at the 80% mark. Now, this will be the percentage of the fee that the service provider's charging you. So they will come out and sit down and have a service agreement negotiation with you. You will have a letter from Services Australia saying you're not paying more than 5%, or you'll be in that 5 to 50% bracket. And the provider will have a conversation with you, and that's how you'll start to work out what your fees will be. There is a fee estimator on the department website, which if you're better than me and can put all your income and assets and things in, will help you to estimate what it might be within that range. But really importantly, Services Australia will send an initial letter, so you've got some sense of where you've landed. And then after the 1st of November, they'll send a letter that's got more detail. But it does give you some information and some power in the conversation that you're having with providers. What we are advising people is that if you don't feel that you've got the information you need, we're going to do questions at the end, if that's okay. At the end of this session, if you don't feel comfortable and that you don't have enough information, you don't have to sign a service agreement. The services will continue. There'll be a process where you can negotiate. But hopefully that letter from Services Australia pre-1 November and then quickly again afterwards will assist.
And I did hear this morning that the letter, so if you're there, I know a number of people put their hand up and said you're supporting someone else. You're registered with My Aged Care as the registered representative or the nominee, you'll receive that letter as well. So the letter goes to both the care recipient, but the person who's nominated in the My Aged Care system as their representative as well.
Now, an important thing to know as we're hitting you with percentages and you're probably in your head going, what does that mean I'm going to end up paying, is that there is a lifetime cap that no one will be asked to pay more than. So it starts in home care and it travels all the way through with you if you go into residential care, and that's not more than $130,000 over your lifetime for these means-tested care fees. So it's not never ending. It does come to an end. Also importantly, and we've got our colleague Chris from Services Australia down the back of the room, so they'll be the people doing the assessments, income and assets assessments. But importantly also, if you find that you're in a position where you don't think you can afford to pay the fees that are being asked, you can apply for what's called hardship. That's not a great term, but that's what it's technically called, or a fee reduction. But it just means that if you're having trouble paying, you can go to Services Australia and ask assessed as to whether you can get your fees reduced or waived altogether if you're having financial difficulty. And that's a really important part of the piece.
And the other part on it, when you apply, put that application in, you might have to do some preparation work to have the information ready. We'll be doing some work at OPAN to get some fact sheets ready for that. When you put that application in after the 1st of November, then the provider can't keep charging you those fees until that's been assessed. And Services Australia have been doing some great work about simplifying the form and the amount of evidence that needs to be provided and how quickly they're doing the turnaround on it. So that's been quite impressive how they've improved that. But there is still some information like your bank statements and things like that that you'll need to collect if you're going to put that application in.
But they have been working really hard to try and reduce that. And then, as I said, initially the prices are being set by service providers, but from about the middle of next year, the Independent Pricing Authority and government will set a cap that providers can't charge more than. And I know people tend to feel more comfortable and confident when that's in place. So that will be in place mid next year. So just in terms of our job going forward on this is we want to monitor overall, is it still affordable? Can you still actually afford the services that you need, and can you still get them? And if you do need help because you can't quite afford it, is that hardship process working the way that it should? So those are the things we're going to monitor as this is being implemented. And the key things for you to remember is there is a cap. You can change your provider. They can't charge an entry or an exit fee. So if you did decide, if you're an existing client and you decided you wanted to change providers, they can't charge you an exit fee for doing that. And remember, you don't have to feel pressured to sign a service agreement if you don't feel you've got the information.
One of the ones that came up yesterday, or we've been talking about, is if the prices that the providers are charging, which means there's less hours of service, what do people do?
Yeah, so I did try to cover that, but it's a good point to bring back. You can do a couple of things. Well, there's probably the three things you can do. You can actually ask to be reassessed so that you might get a high level of package. You can also shop around and decide that you want to have a look for another provider their fees may not be as high. And if you're really concerned, you can make a complaint that you think the fees aren't reasonable and they can be reviewed. So, how are we going for questions? I think
we've got
one more slide there or not?
Yeah, one more slide on existing people, I think. Yes.
Yeah. That was...
that's right. Yep. And your unspent funds, they come across. That's been one of the biggest questions.
So sorry, we covered that earlier, the slides. I've got out of sync with the slides. I got excited because I talked about existing participants first.
Yep.
Firstly, a comment from there's almost 100 people joining us online at the moment. Are there copies of the table material for online people? They're saying it's a bit of a chat in the room at the moment, so we're sorry about that. The slides that we're going through will be sent out to everyone that registered at the end, but also if people are feeling like they're missing out the chat, this is the chat box online.
There is a support at home participant contributions fact sheet that the department has produced, which you can get on the department's website too, if you're online.
Okay. So I would like to know, if I just can't afford to pay for my services for whatever reason may be, do I have to go without?
If you can't afford to pay, you'll need to go through a process to get a fee reduction or a waiver. So you will need to go through a process. It's not just about saying, I can't afford them. And we would encourage you to go through that process rather than to go without.
Yeah. And this has come up, and this is one of the ones that we are concerned about, is around things like showering, where there's the co-contribution on what's personal care and showering. And we actually think that really should be considered clinical. We'll keep pushing that, COTA and OPAN, but we don't want people to go without. And so rather people talk to us and get some support about putting that application in than going, oh, look, I'll just have one shower per week, because we know what happens is that then ends up, people get wounds, they get poorer hygiene, those sorts of things.
Nobody really asks someone to come in and help you with a shower if you don't really help, do they? So So look, we are going to argue about that one, but please don't just go, oh, this is all too expensive and too hard. I'm not going to have any services. Try and go through the process with Services Australia. And you can also let, as you know, OPAN does have advocates that can help you with your individual advocacy, but also think about letting Jenny and her team here know and us know, because those are the sorts of things in terms of our monitoring that we'll be saying, this is an unintended consequence, as too many people are saying no to services, and that's not what we wanted. So we need to keep that information flow going through if those issues arise.
Who is going to monitor the providers doing a monthly meeting with clients? There's no way I can see this ever happening.
That is a good one. Because at the moment, so what people will be doing is getting a monthly care statement, and on that it should have that care management has been provided.
Yes.
But if it's blank or not on there, that'd be time to be ringing your provider and saying, why not? And I haven't had a call. You can also call ADACAS through 1800 700 600, and they can have a chat to the provider as well. We want to see a little bit more transparency on that to make sure that people are getting the right hours of support, because some people will need more than just that one call per month.
That's right. So look, ultimately, the Quality and Safety Commission's responsible for monitoring that. But this is one of the reasons while this feels more complicated in terms of the amount of information that's going to be there about the services you're receiving, we hope that one of the trade-offs for that will be that you can see more clearly what is and isn't being provided than what it has been under the current system to see.
We did have a hand up the back. Do you still want to ask the question? After that, we might, there's a couple, but we're also at about half time if people want to have a little bit of a stretch and 5 minutes. And there is food, but we will deal with our 2 questions before we do that. Firstly,
for my sins, I'm with Trilogy Care, and they are sending us correspondence to say that they're going to be sending out contracts for us to sign. Is that the service agreement that you're referring to?
Yes, I think that's what they'll be talking about.
Okay, and it was the way it was worded was that it was a foregone conclusion that you'll just sign it and send it back. And I said, well, I want it posted a hard copy, and I'm not reading it online. I want a hard copy. So I still haven't received it as yet. But within that, Craig, I think you said that I can refuse to sign it until I see, with transparency what I'm receiving and yada, yada, yada. What are the providers going to do? And I'm managed. So will that be different to people that are getting the support at home that aren't self-managed? Will there be different fees? Will there be different ways of doing it? Or will it all be this?
There shouldn't be different fees for the types of services that you're receiving. And you're right to sort of ask for a hard copy and to say that. We understand, I think there's a fact sheet from the department that talks about this, that there will still be continuity of care while this transition's happening, is what we understand.
So the things I'd be looking for was, what are the terms and conditions for the service agreement of what are the services they're going to provide? What's the price? And often that'll be price per hour. And waiting for this letter from Services Australia to say, and this is the percentage contribution that will be then confirmed in November. But you'd at least want to know that what your contribution percentage is going to be and what their hourly rates are, that sort of information.
I think if you find that they're pushing you and you need some support, then an individual advocate from ADACAS will help you with that, because that's not the way that it should be rolling out.
Last one before the break.
With the terms income and asset, has there been any legislative change to their amendment to their meeting, or are they any different to what's currently used for assessing eligibility for income, age pensions and the like?
Age pension hasn't changed. I'm looking at our friend from Services Australia. I don't believe the assets have changed either, but I'm going to go to someone who's in the detail of that every day.
Sorry, I'm Chris. I'm from Services Australia. I'm the aged care specialist here on the south side in Canberra. There has been no changes to how income and assets are treated, but what has changed is that it is now means tested for the supported home which means it's both income and assets where the previous was just income tested. So there have been some changes there.
Thank you.
On that note, do we want to give ourselves a drive? 10? How long, Pat?
10.
So we'll be back in here at 1:45, and I think there are some refreshments outside, so don't bowl over each other getting out there, but there's tea and coffee at the
on the bench.
We might move into the residential care standards section, Craig. And
Actually, what we're going to do just before we move into the residential care section is over the break, we got some questions about the Commonwealth Home Support Program. People said it wasn't very clear. So we just wanted to, I'm wondering if we can get this very groovy music off.
well, you can sing the answer.
Yeah, sing the answer. No, trust me, I wouldn't inflict that on people. But to be clear, there are currently operating two programs. One's called the Commonwealth Home Support Program, and it used to be, some of you might know that it used to be called the Home and Community Care Program or the HAC program, and it funds low-level individual services for you at home. So you can be assessed for a Commonwealth Home Support Program and just get cleaning done and nothing else. And it's the program that funds things like Meals on Wheels and some of your really local volunteer community services. So that's the Commonwealth Home Support Program. And then the other program's called home care packages. And Craig described really well earlier what a package is and how it's a group of services that you're accessing through a single provider. From 1 November, the home care package program will be called the Support at Home program. And then over time, and not before July 2027, the Commonwealth Home Support Program will come in to be called Support at Home as well. But that's the work that's still happening. If you're currently receiving a Commonwealth Home Support service, that will continue while there's work being done by the department, etc., to determine what does it look like from 2027. We want to make sure that the issue that was raised earlier about them is because they used to be joint Commonwealth state funding, and so there are really different makeup of services in different states and territories from each other, and it's patchy, so you can get a service more easily in some areas, and in other areas they just say they've got no availability at all. So this is another opportunity for us to try and influence how that gets addressed from 2027. But the key thing is 2 programs now, but they will be 1 program from 2027, and that work's occurring now. If you're getting Commonwealth Home Support Service now, that will continue.
Correct.
Hopefully that's clearer. Now I'll let you talk about residential care.
Okay. Well, naturally, residential care is that really high level of support because you're living in a facility, and there's now 24/7 nursing. I think it's about 99% of the time across the country. So there's those high levels of clinical support for people who need it as well. There has been a new funding model that's been developed, probably not needing to know a lot of detail, but once you've sort of moved in to the residential place of your choice, hopefully you've got options. Sometimes it is hard to find a place there as well. It's really important to make sure it's a residential care place that's going to work for you. So often that works by word of mouth. There is a thing called the star ratings. There is going to be some improvements happening to the star rating system about how well they're meeting the quality standards, which I'm going to talk about in a sec. But this was kind of the big thing that came from the Royal Commission, that we really needed better care and support. We needed greater respect for people. We needed people to be still able to make their decisions when they're in residential care as well, and for their rights to be respected. So the Statement of Rights covers you if you're receiving support at home, covers you even if you're getting the Commonwealth Home Support Program, but importantly, it's really important within residential aged care. And there's a tendency, I suppose, to defer to the family members and to talk to them. But if you move into residential care, you are the person that is important. So we move on to the next slide, which actually shows what is coming. This is the strengthened quality standards. Before it used to be a pass or fail. What actually drives continuous quality improvement in the system, and we want providers not just to be meeting the base minimum, but really be exceeding expectations. And so there's a new way for the assessors to come in and look at people who are, not complying with the base minimum, but those that are actually doing really good stuff and exceeding expectations. For me, what's really important is that number one, the person, you. You are the most important person in the standards, and these standards, the person covers you in supported home as well as in residential care. And that's about respecting your diversity, respecting your background, respecting your choices, and getting to know you as a person and allowing you to connect with the people that you want to connect with still. There's other things that have improved, like food and nutrition. We've heard a lot of times that there's just not a lot of choice in the food. Same old. I remember Rosemary, who's part of our reference group, saying nuggets, chicken nuggets done 6 ways and that sort of thing. So there's a lot of work that's being done to improve food and nutrition and to monitor that. And if people are concerned about the food, the Aged Care Quality and Safety Commission has a hotline. Don't know what you do if the food's cold. Do you still call the hotline if the food's cold? But it's there to say, look, the food's not right, and for also the providers to get advice about what to do. The other thing was important that there was really good clinical care, and so there's been strengthened standards around how wound management's done, how medication management's done, but also importantly how palliative care and how dementia care is provided. Now, there needs to be more training for staff, and that's something we'll keep pushing in the committees that we're involved with, about the right training for staff so that you've got the right staff with the right skills in the right place at the right time. The environment, making sure that there's freedom of movement, you've got the right to move, and you've got the right to still stay connected to your community as well is really important, and to have visitors. Okay, and then we come on to how you pay for the residential care. The existing residents, if you're in a residential care or if you've got a friend that's in there or a family member, there'll be no changes to the contributions. And that's part of the no worse off principle. People who are in residential care now won't pay any more. All the clinical care, like in supported homes, so the nursing care, the physiotherapists, the OTs, exercise physiologists, that's all paid for under that new funding model system, which you might hear called as the ANAC, ANCC, something like that.
We should do a vote at the end about whether we've got enough
Acronyms there. So it's the aged care classification system, basically. And there's higher levels of money that are provided depending on your level of dependency and service and care needs. Residents will, though, contribute to some of the non-clinical care services and some of the costs for that, and that's such as the personal care, and that's through a new thing called the non-clinical care contribution. There's also a hotelling contribution. There's the basic daily care fee. There's the cost for the accommodation, which I'll come on to, and there was the one that I talked about before, the higher everyday living fee. There's the brochure for those who are in the room, which is the one that says Understanding Fees for Aged Care Homes. That's got all the information you need in there.
And for those of you online, don't forget you can get that from department's website.
Yep. So when we get to the hotelling supplement, that's like things like cleaning and laundry, and that will be like in supported home, that will be means tested. So it'll be about your income and assets. Now, for the actual room itself, the way I've heard Pat describe it is the residential refundable accommodation deposit, or the RAD, is it often, there's another acronym. That's going to be indexed each year, and that's like kind of leasing your room for while you're there.
And you pay that in a lump sum.
Lump sum upfront. What's going to happen is for new people coming in, that they're able to, at the moment, they won't be able to, they just get earn the interest on that and keep the interest. And then when you move out, then that goes back to either your estate or back to you. There will be, from now on, they'll be able to take 2% of that for the first 5 years. And that's to continue to, I suppose, fund the upkeep of the home, or to build more rooms and beds.
And that's called the retention.
The retention payment, yeah.
It's not something we were big fans of, but it's something that nevertheless has been introduced to the system.
At the room price caps, there was a standard price that was kind of the base. Everyone could charge 500,000, and now that's gone up in January to that they automatically can charge 750,000 for the room, the bed. But there are other places that can charge more, but they have to go through a process of applying for that. There are some places in some rural locations where, because of it, they might actually have a lower price than that, but that's kind of the automatic that they could go to.
That's right. Yep. I just was remembering that was a question yesterday about, some people are charging more and some people are charging less. So that's a good explanation.
Yeah. So that's if you do the upfront payment, the RAD, refundable accommodation deposit, a little bit taken off for those first 5 years. The other way you could pay for that room, for the accommodation, is through the daily accommodation payment, or the DAP. That will also be indexed each time. So this is kind of like if you're renting the room, and it will change each year as the CPI goes up as well. Now, you can make a decision to pay a RAD, or you can make the decision to pay the DAP, the daily fee, so lease it or rent it, or you can do a combination of the two things and you can work that out. It can get a little bit complex, and again, Services Australia are really great. The aged care specialist officer is really good to speak to get more information on it. But you can also it's really good to get independent financial advice because of the implications. Now, remember, as Pat was saying before, though, that 130K cap, that follows you from supported home into residential. So for the non-clinical care contribution and the hotelling contribution, that's part of the maximum 130 that you'll pay for your whole life, is part of the means testing contribution. So, so mostly there's not huge amounts of change, other than we're strengthening the statement of right. We're strengthening when you're coming on to supported decision making. We're going to come to that, and we're strengthening the quality standards. The other thing we mentioned earlier on was the code of conduct. Now, that applies to all the aged care workers. It applies to their bosses, applies to the director of nursing, and applies to the board of the aged care home as well. So if you're got concerns about the care, there's actually a code of conduct that they need to follow as well, and Pat will tell you a bit more about that in the complaints part in a minute. Peter, questions?
Yes, coming through the technology, we've got a number of questions about technology. Firstly, I'm a self-funded. What is online in the My Aged Care portal with respect to the new arrangements for residential care is inadequate to begin to estimate for two parents in their mid-90s with modest means?
Agree.
Oh. And?
So look, we the estimator is good, and some people can use it. It is difficult. I had difficulty using it, and I'm not in my mid-90s, or at least not last time I checked. So it is good to do that with someone. Some people can use it, but I understand what people are saying. You do need support, and this is where the letter from Services Australia, when you're if you're currently in the system, or when you apply to come into the system, that will help you to know exactly what that is.
But we'll take that back as well.
We absolutely.
There are a number of comments, actually, the estimators are not helpful.
Yep.
Another one that's a little bit associated, a lot of older people
still are unable to, or simply don't have smartphones to get notifications of changes coming out either under HCP or CSHP.
And we do.
Will postage of letters in the mail still be an option?
So we absolutely do still support that things need to be provided in writing and postage. Some of the other work that we do at COTA too is about making sure that we don't lose all of our Australia post offices and all of those things. So we are advocating around that as well. But yes, thank you. As Craig said, we can take these comments. This is really useful to take that feedback about the estimators not working and not being as helpful as they should be.
Now, we believe there are some updates coming.
Yes.
But we're just not exactly sure what date they're going to be there. But we'll try and keep you informed about when there's any updates to those estimators.
And we'll try and do that through our newsletters rather than...
Yes.
Yeah, we won't text you.
No.
And from one of our friends online, they are keen to get links to the fact sheets put through. So we do undertake, we'll put all those up before the end of this or soon after.
Yeah, and linked with the, like we said, with the slides and telephone numbers as well.
All right, are we ready to move on, gang? Good. Let's go.
Is this the sugar? Is this the after sugar high? You've all gone a bit quiet. I'm going to talk to you now about complaints. And I think the common thing that we hear now under the complaint system is that people don't necessarily feel they're being listened to, or that they don't think anything happens if they do make a complaint. And we know it's really hard to make a complaint when you're complaining about the very service that you're relying on. The Royal Commission really did highlight that people had been making complaints, things hadn't changed, or the plight that people were in, and so many brave people came forward to talk about what had happened. And we don't want a system where people are afraid to speak up. A good complaint system is going to improve the system overall because it does provide feedback. It shows where there are problems and flaws in the system that need to be addressed. So we really need this to work well. So there are a range of things that we've touched on some of them already, but we'll just touch on them again. There are a range of things that are designed to strengthen the complaints system. The one that we think is really key is the notion of the Independent Complaints Commissioner. I think it's really, really important that there is someone independent from the person who's accrediting aged care services for older people to be able to talk to. The other really important thing around this is that the system and the way complaints work will now include things called restorative pathways. In the current days, and I had personal experience of this with my mum, you kind of did a complaint and you got a letter back saying these things were upheld, or there was found that there was nothing that needed to be changed, and it was kind of the end of the system. The notion behind the restorative pathway is that there would be conciliation or mediation for you with the provider to make sure that it doesn't happen again, but also to ensure that what your experience was is really understood and listened to, and improve services going forward. So those are new things that don't happen in the current system, which we think will be good. So I think the complaint system will be stronger. We've got a dedicated and independent complaints commissioner. Craig's already touched really well on the statement of rights, but that's important, and you can complain if they're not upholding your rights. And the standards, those strengthened standards, become really important in terms of the Quality and Safety Commission taking action on those things. The other thing that is happening is the whistleblower protections have been strengthened. So you might know if you're someone caring for someone that you've seen something you're not happy with, or you might be a family member, or you might be a community member, and you can see that you've been in to visit someone in residential care and you go, that's not right. It gives you strong protections to be able to complain anonymously and have a series of protections around you.
That there can't be ramifications.
Can't be ramifications for it. So really important. And then while initially there was proposed to be criminal penalties in the Act where providers had done the wrong thing, they don't have, the Act no longer has criminal penalties, but it has civil penalties. And they can be applied if providers breach their duty. It's around to 1.5 million. But other things that can happen if the providers have done the wrong thing is they can have their provider status revoked or suspended while that's addressed. Workers, as we talked about before with the Code of Conduct, workers can be banned, but also so can people in governing bodies be banned now, which is really an important protection. We think there's more work to do on restrictive practices. That's partly because states and territories still have a role to play, and the government has to work out how all of those things come together. But overall, we think that they have strengthened complaints. And again, we'll be monitoring and looking at how that works as we go through the process. And happy to take some questions.
Yeah, and hands up if anyone does. I'll come at the back in a sec. Look, the big challenge is the fact that people rely on their providers and feel vulnerable making complaints. How does this really change anything?
Well, I think we talked yesterday about what we're trying to do is change the culture. I think at the moment, lots of providers see this as being critical of them rather than being able to take it on as feedback. But I do think the whistleblower protections will help, and that it won't just be. People are still going to feel difficult about it. There's nothing else to say. You're still going to feel difficult about making a complaint when someone's looking after you. But what this does is try to strengthen all of the supports around you to make it easier to make a complaint, to protect you if you do make a complaint. And it's really important to know too that if you're really uncomfortable, OPAN exists because they do independent advocacy, and you can get someone to help you make that complaint and monitor that there's no fallback.
Yeah, and what ADACAS does is they, as the frontline member of OPAN in the ACT, is they go into residential facilities to talk to people one-on-one about their rights, about how to make a complaint, for people to talk to them. Under the new legislation, the providers have to let us in to do that, which is really good. And that the Commission, if we say something, the Commission needs to listen to it as well. And so that advocate will also keep your issue confidential if you that. So another plug for that 1-800-700-600 number if someone wants to get that information or wants them to do it on their behalf, or walk alongside them and help them to raise those issues, so you can feel confident that you can raise your issues. But providers should be really looking at this as a great way to improve their services, and a lot of them are shifting their thinking around complaints.
And we do want to make the whole system work. So it's not a perfect answer, and we understand people are still going to feel hesitant. But what we've been focused on in our advocacy around the Act is strengthening the protections and the supports around people so that if they do complain, they're better supported and better protected.
Yeah, I'm just wondering why you've sort of put down from criminal to civil, because it's actually criminal what they're doing to the aged. It's aged abuse, exploitation, and your Aged Quality Care and Safety Commissioner, if that's the same person, Complaints Commissioner, they don't look after the aged, they look after the providers, and they all do. So they all look after the providers. So what can you do to change that back to criminal and actually take criminal action against these people? Because that's the only way you're going to end it. And then furthermore, considering to do a lot of the aged are asking that they have that money put into their own pocket rather than having new jobs there if the Complaints Commission is a separate person, that's more money out of the aged pocket. So they can get things done on a need-to-care basis rather than not getting any of the maintenance and the work that needs to be done.
So we did advocate that criminal penalties should remain in the Act. Unfortunately, government's made a decision not to. That doesn't mean that we won't continue to advocate for it. And our job today is to explain what's in place from the 1st of November. Doesn't mean we won't continue to advocate for change. We did see the creation of the Independent Statutory Complaints Commissioner was strengthening and trying to overcome that conflict of interest that you described. So we did also advocate for that. We know that there's a lot of disappointment and people feeling that the criminal penalties should have remained. We can only tell you that we did advocate for that, and government's made a decision at this point in time not to. It doesn't mean that it's something that we won't revisit.
Yeah, and there are two things. Where there is significant harm caused, there is compensation that can be that. So that's not criminal penalties, but actual serious compensation payments to the person that the Commission can do. The other thing to say is that it doesn't mean that people are above the law. So if abuse happens, if someone physically harms someone, if they break the law, they still fall under the criminal penalties of those sorts of things. So the police can still charge someone for hitting, punching, abusing someone, or sexual assault any of those sorts of things. Just because you're in aged care doesn't mean you don't have those protections.
Absolutely. You have those rights still.
Yeah.
Sorry, Pete, there's one question at the back. Do we have time to do the one question at the back, or we need to move on?
Can we hold it? We'll do the last section and then I'll come up to you first. And if
Can I just say on one of the complaints, because we did have this question about the timeliness on the complaints yesterday, and I think it is important to know. You want to talk about where we're up to with time frame?
I have actually been working with the Complaints Commission to actually be really clear about what are the steps in the process and how long does each step take and when would you expect to be able to get a response. There are some fact sheets around that, and we think they are now much clearer about the steps in the process and how long it's going to take, and we'll make sure that we include the link to that information as well.
Yeah, it's things like they'll have looked at your inquiry and triaged it within 3 days. They will have contacted you within 10 days. They'll keep contacting you every couple of weeks, and they'll aim to have it resolved. I think it's within 3 months.
That's it, something like that. And if there's a variation in the timings, they'll also let you know about that, so you'll be kept informed all the way through. So I think that's going to work better than it has been.
All right, so then we're on to our final topic for today, which is supported decision making, which is something I'm really excited about because too often we've had in the system where there's been this assumption that you either start receiving aged care or you become older and you can't make decisions for yourself any longer and everyone has to do it for you. And we know that's just not the case. And so we've pushed really strongly for a model that's called supported decision making. And this links to the United Nations Convention on the Rights of People with Disability that says there should be an assumption under Clause 12 that everyone has the right to make their own decisions. That means that you can still access the information that you want in the way that you want. It means that you need to be provided information in a way that you can understand, accessible. So it's things like people might need a translator. They might need that explained to them in a different way, and that your wishes and preferences need to be respected. So this is really important, though people would have heard of enduring powers of attorney or an enduring guardian. They vary a bit different, and that's tended to be what's called substitute decision making. Now, even with those, you still have the right to make your own decision, even if you've appointed someone take over if you've got to the point where you can't make those decisions yourself. And often, even when there might be times of the day where it's a bit harder, when you're sort of at 3:30 in the afternoon after a long day, you might start finding it a bit hard to make those decisions. So it's working with you to find how do you give you the supports to be able to still make those decisions. So even where people don't agree with your decisions, they still need to respect them. And that's even if those decisions might take a level of risk involved, and people still need to respect your right to still take risks, to connect with the people you want to connect with. That's really important, and to assume that that you've still got legal capacity to make those decisions. Now, sometimes that power of attorney might have been put in place, and so certain contracts and those sorts of things you might not be able to sign, but you can still make everyday decisions about your life. So even if you have a substitute decision maker appointed, which is our next slide, you have the right to be involved with the decisions that substitute decision maker is making, and those decisions remain yourselves, and you can get the supports to do to be part of that decision making process. So it's that idea of nothing about us without us. So the other thing that's coming in with the new system is called a registered supporter. Previously, it'd be called a nominee or a representative or your registered representative. This is a person who is appointed under the Aged Care Act to get information in relation to your aged care, and you decide who that person is. If you've got an enduring power of attorney in place or enduring guardian, they'll automatically come across and be that person. But again, the principle through the whole system, including for the workers and your family as well, is they support you to make your own decisions. And so that's kind of what we're trying to build, is this culture of continuing to not take away people's agency and empowerment to make their own decisions. You can register someone to be your registered supporter, or you can register a number of people to be your team of supporters. But you can also choose to not have someone there as well. The other important part of this under the new legislation is if they do something wrong, if they use their position, that really privileged position that they're in base, that you put in them and put your trust in them, and they use that to abuse you or financially abuse you, they can be penalised and they can be removed from their system as well. So I think that's some really good, strong protections, and that keeps you choosing who you want to be part of your support team.
I'm just going to say there's also obviously the enduring power of attorneys, etc., sit at state level, and there's a range of different ways that they're administered. Some of the work that we also do, both organisations, is to actually advocate to make sure that there are stronger protections around that and greater national consistency, so that if you do have a problem with your enduring power of attorney, that you can get support.
Yep. Pete, any questions on this one?
One specific, you mentioned earlier, if people don't see the monthly meetings happening, they should call up. But aren't we out of touch suggesting this because we're putting too much onto the client?
Yes, we are. So I would like to see a system where we can actually be getting some transparency and reports on what care management's happening. The monthly care statement, and you'll get one if you're in residential care or in supported home. Probably the quickest way that people can see if it's being delivered. But we want to monitor at a systems level whether those care management minutes or the care management time, care partners are delivering the services that they need to do. So we'll keep a monitor of the system.
In terms of how we monitor and evaluate, but for some people they'll be really comfortable to do that, but we know for others they may not be able to.
So I'm going to run up the back and give my mic over. While I'm doing that, Craig, there was a point of clarification of the relationship between OPAN and ADICUS. Maybe you can just
absolutely
back.
Yep.
So run up the back.
OPAN is the big body, and the government has given us the contract to deliver the National Aged Care Advocacy Program. So that's that individual support that's provided for information, education, and to help you resolve your individual issues. But then we fund ADICUS to do those frontline services out on the ground. So when you ring 1-800-700-600, the phone call goes through to ADICUS, and they'll support you and have an advocate either talk to you on the phone, give you that information, or come out and see you and provide you that support and talk to your provider about the issues you're having. And it's really good, probably segue to say what COTA Australia versus COTA ACT does.
Yeah, and I mean, we're a systemic advocacy organisation, so we, COTA ACT does run a lot of events and things here and talks to people on the ground, but our job is more systemic advocacy. So we look across the system and see the things that need to change. We work in aged care, we work in health, we work in retirement incomes, we've been arguing about keeping cash available, keeping post offices available, making sure that people can get written information. So we take a really broad approach across all of the things that impact anybody. We say over the age of 50. Some people are a little bit shocked about that, but actually discrimination in employment starts around that age. So we work right across that. We're very involved in aged care, but we generally are more looking at the systemic level than individuals. We do get individuals ringing us, but where it's an actual issue that you need an individual advocate, we would refer that to OPAN.
And B from ADICUS is going to come up in a minute and tell you a bit more about that ADICUS. So.
And COTA ACT also, we from the national office, so we really interact with the federal government and talk about federal issues, and COTA ACT really deals with issues at the state level, territory levels.
Hello. My question is related to the last section, but I just wanted to say how appreciative I am of the information you've given us today, because sometimes some of us might be hearing it for the first time. I've listened into a number of the OPAN sessions a few months ago as well, So it is helpful to have that information. My question related to the complaints section, and it was good to see that there was a dedicated complaints commissioner, and I was just wondering whether that was one that was on a national level, or was it done on a state-by-state and territory basis?
This one that we're talking about is national. So the commissioner will still be attached to the Quality and Safety Commission, but we really argued strongly it wasn't going to be a separate statutory body with its own power, a statutory commissioner with their own powers, and that's what we really advocated to do. So that's available across the country. So if you've got a complaint about aged care, it will go to that statutory commissioner.
Thank you. I have one other question that related to care, because sometimes aged pet care recipients have to be treated in hospitals as well. They aren't always in an aged care facility, and some people are cared for at home, and sometimes things can go wrong in any of those situations. And I was just wondering whether the Statement of Rights, which is a stronger one than the Charter, whether that is something that's is available to aged care people when they are in hospitals.
So there's separate Charter of Health Care Rights that covers the services you might be covered in the hospital system. There are health ombudsmen that you can make a complaint to if it's about a service there. So it's a little bit different to whether the Statement of Rights is because who funds the ACT health system, I suppose. Yeah.
It's frustrating though, isn't it? Because really as a person, you just want to know that you can go to one person to make a complaint about things that have happened. I do think that the Royal Commission made recommendations around the aged care and hospital kind of interface. And a lot of that work hasn't really been done. And it's another area we're really pushing to try and improve.
One of the things I was saying yesterday is just because you're receiving aged care doesn't mean you don't get services from your GP or a GP coming into a residential facility, or things like mental health, primary mental health care plans and those sorts of things. You're still entitled to all those sorts of things.
As a citizen of the ACT, all of those things that anybody is entitled to access.
We're in the wind-up stage. One more request for you to pull out your phone. We want to know, having listened to all this, how you're feeling now, whether you feel a little bit more informed, whether or not you're more supportive, less supportive. Those that don't have can show up a 1 or a 5 on their hands. You started as a 5. Are you still a 5? Oh, you're still a 5. Couldn't really move you. So we'll give that a couple of seconds to wash through. Still some people with a bit more information that we need to share, but I think things are moving up a little bit from where it was at the start. You can keep filling that as...
and it's a lot of information we've gone through in a relatively short time, and I'm sure that you will go away and think, I didn't ask that question, or I didn't really understand that, or I'd like more information about that. We are going to continue to try and give information. We will send the slides out. We will try and send the links out for you so that you can follow up. I know OPAN's got another couple of webinars that it's planning to do, so we are going to try and keep the information up as much as possible.
Yeah, so there's a webinar on the 23rd of September on high quality care, what you should expect as high quality care, which is now defined in this new piece of legislation. We had a big Q&A session a few months ago, and we had 4,400 people register for that. We're going to redo that December, so that there's still questions at the end. I think it's important.
It was you and I doing that.
Doing that one again. We're going to do it again together. Also important to know that we don't reach nirvana on the 2nd of November. This is a piece of legislation that starts to bring the culture change that we want to see, the type of aged care system we want to see for all of us over the next generation. So it won't happen overnight, but it will happen, and we will keep pushing for further reform in aged care as well.
And a couple of useful things to know is one of the other things that we advocated for and were successful in getting, I'm using the royal we that COTA and OPAN advocated for, is a legislated review. So initially there wasn't going to be a requirement in the Act that it be reviewed. There was an intention that it would be. but we've advocated and got a review that will happen at the 3-year mark. Now, that doesn't mean nothing will change in the 3 years, because government's also made sure that if it needs to make some changes because there's unintended consequences, that it can look at that. But at the 3-year mark, everything will be looked at to see, is it working the way that it was intended to work, and do we need to make any changes? And also there is an Inspector General of Aged Care, and Natalie Siegel-Brown, it's her responsibility, and she's looking at how all of these governance things are happening, and is the system working in the way that it should be. So there are also some checks and balances on what's happening through the next period of time, and then we've got the legislative review.
Finally, we might just leave the last slide, which is an open-ended. Anyone, any reflections, thoughts on the day's discussion? Craig and Pat, have you got any reflections? This is now the second conversation, but the questions we're getting are really detailed.
And it's great to see so many of you out.
And people online, thank you for being online as well.
Absolutely. And I think what it underlines for me is the importance of, I think Craig was quoting Gwenda, knowledge is power, and we need to make sure that you've got as many opportunities as possible and as many ways as possible to get the information that you need while this is being implemented.
No reflections from the floor.
Well, they can add them later. And I think there's also return to email that people can use as well if they've got anything they'd like to feedback at the end of it.
Right. Well,
You that?
and
Noel, your taxi is here.
very.
I thought you were doing the final.
No, B's going to come up now from Atticus and tell us a little bit.
Maybe Noel has to do a wrap up.
Thanks, Noel.
Thank you very much. I hope you all agree that this has been a very informative session, and I'd like to thank Craig and Pat for their very informative information they've sent to us. I know it's a heck of a lot of information for you all to take independently with you, but take all of the flyers and information that you've got, have a good read of them, and be happy to contact 1-800-700-600 to call Atticus if you need any support or any information to help understand it a bit more. It's a lot to take in. So Atticus, as Craig said, Atticus is under the umbrella of OPAN, which is the Older Persons Advocacy Network. And Atticus, the acronym is ACT, Disability, Aged and Carer Advocacy Service. We've been supporting older people and people with mental ill health and disability and their carers for over 30 years here in Canberra. So we advocate for our clients to make informed decisions about your aged care service. I'm B. I'm the team leader of the older persons team in Atticus. So in my team, we advocate for our clients to make informed decisions about your aged care services, understand your rights, and have your voices heard. So in the older persons team, we have several advocate roles, specialist roles. So we have a called advocate for people who are culturally and linguistically diverse. We have financial advocates that help you to talk through your financial information and your accounts and your fees and charges in residential care and community services. And we also have our community development officer, who you might see sometimes at Westfield or at a library. Jojo is down the back today with us, handing out information. And you can always go and see him when he's at a stall, at events. The new Aged Care Act puts older people at the centre of our aged care services, and the statement Aged Care gives information about the statement of rights, supported decision making, and accountability from the providers. We all have the right to be supported by an advocate. So if there's any questions, I'm happy to answer any. Otherwise, thank you very much for coming today. I'd also like to thank Jenny Mobbs and her team for having us here today.
And can I also say, as you leave, if there's catering over, please feel free to take something home.
I think I meant to catch. Check. Okay. Take it current. It's it. That's me. Or